Thanks to Michael to invite us and to organize this webinar together. I'm here with Dr. Emiliano Ferrari, that is a dentist and also a technician. So he has the knowledge and the skill on both sides, and this for us is very, very important to know all the step-by-step procedure. So I'm the CEO of the Rhine company, and we are one attachment company in the market since 35 years. So it's more than 35. We are popular for many different design of attachment, but today we will present the feature of our, we can say, top product today that is called OT Equator. Is also an attachment that can be used in a different way, and we will see today all the possibility that this product will offer you. I will take care of all the technical parts, and Dr. Emiliano will take care of the clinical side. So we will try to show you all the possibilities in the different area, dental and technical. Okay. You can, Emiliano? Okay, here you can see on your right, on your left, the sphere. This is our oldest product. It's a ball attach. We are very popular for the ball attachment. We have different diameter, and we manufacture this ball, castable, and for implants. This ball work with a female cap that is elastic with different color and different retention. Then we will see how we are becoming, and we design the new solution OT Equator. You can see in the middle, the OT Equator in red. It's our low profile solution, because dimension are very important, is one big issue, and all we are looking for the smallest attachment in the market to have the better aesthetical result. So you can see that we save a lot of space. We have 3.3, we become from 3.3 to 2.1, so we save more than 1 millimeter in a height, and this is really something. But what is very important is that we will have the same retentive area of the traditional ball attachment that we are selling since the beginning. So the retention is the same and is guaranteed, because from the two design, the retentive area are absolutely the same under the equator. So this is my avatar that Emiliano has given me for my birthday. I carry the equator all over with me, and we see now in the upper left all the use that we can do with the equator design, this low profile solution. We start from the root retain, so we do a post in titanium to be cemented in the roots, or we can use in an overdenture implant retain. So we design the OT Equator for all implant brand in the market. ADVA, GC, any diameter, any brand. You have only to specify to Michael which implant you are using, Ankylos, you are using Astra, Freealit, Nobel, MIS, Alpha Bio. So diameter and CAFI, and Michael will provide you the equator for your existing implant brand. Then in the lower area, you see that you can use the equator like an MUA, a multi-unit abutment. So because has a thread inside that later we will see. So we can use the equator to retain a bar that can be casted or milled. Depends the way, the skill and the technology that we have in our lab, and also if we need to contain cost or no. Then a new solution that we will see today and we will focus more than other is the fixed solution, because we have designed a series of abutment to use the equator as an abutment to retain a fixed bridge for immediate loading, delayed loading with a guided surgery, digital, analogic. So you can use the same abutment for all the different, for 6 different possibilities, because you see over the bar, there is also the equator for CAD/CAM. So we have the roots, implants, CAD/CAM, and fix. So we have so many possibilities with one simple abutment, okay? And we will see during the lecture the step-by-step procedure. So when I go back to the design of the equator, you can see that the equator is very small, very static, and you see on your right that there is one internal thread that is square because we need to screw the abutment, but the square is threaded. This thread that you can see can be used for retain a possible bar or a possible bridge. So that is very important. So it can be used single or to retain a bar. This is a video because
Line 83, the leading manufacturer of dental attachments.
It's a video that shows, like all the overdenture attachment, that the equator is working with an elastic cap. Every elastic cap, you see that is square, is threaded inside, is yellow because the nitride coated give to the surface 1,900 Vickers. So no possibility of wearing. And we have different color of caps for different retention forces. So you use the softer or the stronger, depends the number of abutment. And you can see here, the area of retention is the same of the sphere. So it's really guaranteed. You choose the right retention, number of implants, if he's an old patient, if he's a man, if he's a flat ridge, or so we are really to choose, we have the possibility to choose and to personalize the retention for each needs of the patient. Okay. It's very important because to start with a comparison, when we saw that we are the smallest in the market, it's true, and we can show, you can see here, locator is really popular, is in the mouth of everyone. When you say locator or RTX, you can see that how much space you save by using the equator, because we go from 3.85 to 2.5. So you save a lot of room for the nail, and also together assembled is 4.4 metal housing compared 5.5 to the locator or RTX that are the other one from Zest Dental Solution. So imagine how much for us in the dental field and in the lab, 1.1 millimeter, it's a word. So it's a lot of space where we can do frame, porcelain, so we really can take much more care of the aesthetic. So that is the main possibility. It's important also for us to who don't know, equator is already in the catalog of many big implant companies. So you can see from Megagen, MIS, Alpha Bio, Biohorizon, 3 dental implants, so and more Souther implant, all that kind of implants company are carrying already our solution in the catalog. So is already one system well known with very good functionality. So that is, and if you have your own implant brand, just ask to Michael, and Michael will provide you all the abutment in any height, in any diameter for any implant brand in the market. Okay. So now is the clinical.
Now,
Emiliano will show the clinical side. Emiliano, okay, please.
Now I'm starting to share with you some clinical cases in the use of this abutment for removable prosthesis. So we'll start from the much easier way to use it, the use of the pivot on root, and we will arrive showing some case, some difficult case with the use of bar. So this is a case of a patient with hopeless teeth in the upper jaw and in the lower jaw, but we thought that some root had enough root support to be maintained. So the project was to use this root for the retention of denture. And how to treat this kind of root? Easy way. So after the extraction of the hopeless teeth, we just had to go for the endodontic treatment of the root and the preparation with dedicated burns of those roots. And after that, the cementation of the pivot on those. On that way, we can obtain something to retain, something really not expensive way to retain those dentures. But in some case, when we use root, we don't have, we have some divergency between the axis of insertion of the prosthesis respect the axis of the root. So when you put the implant, you can try to put the implant the most parallel that you can. But when you have to use natural teeth, the direction of the retention zone depends on the direction of the root. So if you have divergency in this root, what you can use is a device that it's called SmartBox. Gianni will show us how it works.
Yes. How Emiliano said, the biggest issue is the divergency. Roots or implant at the end are the same because you have to follow the channel roots or the direction of the implant. So when you are going to cross the 20 degree of divergence between implants, you need a device that help you to the retentive cap to go inside in position without any stress. So we made and we designed a smart box that is two metal housing, one inside the other, and we have the internal liner that how you can see in the video is self-rotating to self-align, indeed to save and to correct till 50 degree divergence, 50, PET 0, correct? Okay, so 50 degree, and this is something very, very important because we guarantee a long-lasting retention of the plastic because we have to support and we have to guarantee at least 1 year of retention in the mouth of the patient. So when you have a divergence higher than 20, please choose the smart box to correct this kind of divergence between roots or implants.
This is the final situation. So not hopeless teeth, but teeth that we can maintain. And on that way, we can give retention to this denture with a cheap solution And those kind of solution can go on until those root will survive. And if in the future we will lose some root, our denture can work the same. Okay, not the same, but it can work at all. If we can't maintain some root, the option that we have is to put some implant. So in the same way, we can use those kind of attachment for the retention, not on natural root, but on implant. This is another case of patient with hopeless teeth. And our project is to take out all the teeth, put implant, and realize tissue supported and implant retained over denture. But in the starting situation, in the RX of the starting situation, we check that some root is not too bad. So our choice is to maintain 2 root for the provisional, for the during the healing of our implant, to provide retention at the provisional of the patients. So what we have to do, same things of the other case, take out all the hopeless teeth and prepare the root for the cementation of pivot. In this case, pivot are only for provisional use, okay? But same way of cementing and same way of function. On that way, we can give retained denture to the patient, waiting for the healing of the implant. We go for the surgery, putting the implant in the mandible and in the maxilla. In the maxilla, we don't have some root to maintain, so for the patient, we will have for sure a little more pain during the healing. But in this case, if you want, you can use some temporary implant. In the mandible, we don't have those problems because we can maintain 2 roots. And this is good solution because you can give a lot of relief to the patient because during the chewing, he don't have a problem with the suture, he don't have problem for the healing of the implant, okay? You just wait for 2 months or 3 months for the upper jaw, and after the healing of the implant, we go for the uncovering, and we use those kind of abutment like a healing screw.
So you can see, Emiliano, just I want to show that here is really clear. You can see inside each equator that is square for the screwdriver, and there is the internal thread to retain a possible bar, how we can see in the upper jaw, correct?
Yes. One of the secrets of those kind of abutment is that you can use it for different situation during the same treatment plane. So, as Gianni told you, now we use it like a healing screw, and also for the retention of the provisional. And if the project is to build a bar, we just have to screw our bar on the head of those abutments. In this case, the project was just to build final denture directly retained from the implant, so tissue supported. And a very important thing in this case, in this situation, is to realize a metal frame.
Yeah, so we have a lot of temporary prefabricated components because every attachment is a point of crack. So we really need, if we have the option, you can see that in the blue is we have some temporary, some prefabricated component, castable, ready to be used. So we will, without any duplication, we adapt and we position the castable connector, screw, and cast directly. And you see below, we manufacture a frame that give to the denture a strong possibility and no chance of crack. So that is really, really important. And below, you have the attachment, the metal housing that can be bonded in the frame or in the resin. Here we have the final work. So I'm a technician, but it's are not my job. But you can see that even or upper and lower jaw of a removable denture is not always a poor solution. Depends your skill and your knowledge and your technique. You can give to the denture one very nice aesthetic. You can give a very good tissue support, lip support, where you need stability. So, and good retention, because you have 4 attachments in the upper and 2 attachments in the lower. So good stability, good aesthetic, and also economical. Is an economical way to go compare a fixed solution. Okay.
Okay, so this is the final results, good aesthetic result in a simple way to use this kind of attachment. The last way you can use those kind of equator for removable prosthesis is the one kind of denture that we call not only implant retained, but also implant sustained. So not on tissue, but on a bar. Those kind of rehabilitation is something that it's in the group of removable rehabilitation. But really, we like to think of that like fixed prosthesis. Because we have the benefit of the removable solution in kind of hygienic way. But we have also the same performance of a fixed rehabilitation. Because those kind of rehabilitation with a bar not only retain your denture, but also give really the performance of a fixed prosthesis. So when we have to go in this direction and not in the direction of a fixed prosthesis at all the effect, there are some cases in which your patients have money and time and desire of fixed rehabilitation. But sometimes anatomical structure and situation of the bone are not perfect for going the direction of completely fixed rehabilitation. This is a case of a patient with bone only in the frontal zone and with the necessity of give help in the correction of some mistake of the face. So you can see that the patient without the upper denture need lip support and need the correction of the nebia level angle, and also, if possible, the correction of the lip wrinkles. So we are not sure that we can have these results with fixed rehabilitation like Toronto Bridge, because in this case, maybe the best solution is to have something with acrylic that can help us in the correction of this mistake. That's why, in this case, we prefer to go with this rehabilitation on bar. Okay. So the surgery is the same surgery for the rehabilitation of fixed, but for sure we don't have to go with immediate loading, so we can put our implant and wait for the healing. After 3 months, when we have the healing of the implant, we go the same way that you saw in the last case, using the equator like healing screw, and using those equator for the stabilization, for the retention of the provisional. So 2 different use of the same device: healing screw, retention of the provisional, and now the 3rd use, so the possibility to screw on those abutments a bar. We can take a really precision impression of those devices, because we have a different kind of transfer, and we also have a screw transfer that are screwed directly on the head of the equator. And this is a very important thing, because to take your precision impression, you don't have to unscrew the abutment. You can leave your abutment screwed, and you can use this kind of transfer. That give you the possibility to save time and on that way to save money, and to not give discomfort for your patient. After the impression, very important things is to check the precision of your impression. For that reason, we go for the realization of this acrylic contour key.
That we do in the laboratory. In the lab, we do the key on the master model and we check the precision.
And if this contour key work the same on the master model and on the mouth, you are sure that you have a good impression. Second things that you have to do after the check in the mouth of the precision is to go with the wax up. So now Gianni will told us how to go.
So we do the wax up on the master model, and the doctor, you see that we have really to take care of following the indication of the dentist. We do the lip support, and they try in the mouth. We wait that the doctor give the okay, everything, you can go ahead. After that, we, in this case, we plan a digital solution. But remember, every product that we do can be used in a digital, web scanner and everything, or in analogic. So everything you want to cast, to wax up, to design, you have the option also to follow this way to go. So we are really open to offer you both the solution. In this case, you see we have scan the wax up to check the space. We have the scan abutment that are related and linked to the library of the Seeger solution that goes over the equator. So how you can see here in the gray area, we have the scan abutment scanned on the master model. So now we are ready with our software that can be exocad, 3Shape, dental wing. So our library is inside all the software in the market. If someone don't find it, you can be related to Michael to ask. We can give you for bars and for the fix the specific library for your specific software to go ahead. So you can see here we are ready following the this is the scanner of the master model. We check the space, we design the bar, we take care of the thickness because it's very important, the thickness of the section of the bar, to design a bar that have to be strong, not risk of cracking, and stay inside the design. We have also the occlusal plane that you can see in the upper left, which is very important to position and to design the bar following the direction of the occlusal plane. Okay, so after that we position the attachment to have one aesthetical result. We go to design digitally also the counter bar. So the secondary bar. In this case, we design the secondary bar. We are not milling, but we mill the primary and laser melting the secondary. Okay, so after that, we have milled the primary bar, we have the secondary bar, we check precision, the thread, we can thread directly the bar, or we can create a hole where we bond a threaded sleeve with composite to retain the equator. So two possibilities, direct thread to 2 millimeter or hole where you bond the threaded sleeve. So then after that, you see that the USLA that are going over the equator is just one hole. So there is no hex. It's very important this because the Seeger system is a passive solution. Means that the bar always fit because there is no hex, no octagon, internal or external. You can see in the video, the bar play, and this play allow you to correct till 80 degree of divergence between equator. Then you see the Seeger ring is going inside and snap to stabilize, and the titanium screw is going to lock everything. In case the day you need to remove, you unscrew the Seeger screw in titanium that are going to remove the peak ring and then allow you to remove the bar for the hygiene, to clean, to control, and this is something that is Emiliano that will do. But you see in the picture in the middle, there are little gap between the two equators. There is, because the milling have different calibration, the impression may give you a little gap. Can be a casting that can be not really super precise. These little gaps are always corrected by the Seeger peak ring that you can see that is open, because when going open and close to go over the undercut and retain passively the bar always. So the bar is very stable, like a traditional, but don't give you any problem of cutting because the X doesn't fit. Okay, so we can go ahead. We are going to polish the bar. We are ready to take care to polish as best as we can the bar, because the patient need to clean correctly the bar alone at home every day. So you can see, you can go back 1 second. You can see that in the upper, there is the, just the hole, no X. This means that are going to fit perfectly always over the equator. The bar has the equator for CAD/CAM on top. So also for the dentist, it's very easy because you don't need so many components, because the retentive cap can be for bars, for implants, single, or for CAD/CAM, are the same retentive cap. So we finish the denture, we give the aesthetic, how the doctor is asking and request, and then the doctor is trying and screwing the bar in the mouth.
Yeah. And this is the delivery of the rehabilitation. So the results is aesthetical results and with the same performance of a fixed rehabilitation. But in this case, as I told you before, only on that way we can solve the problem of the lip support. That's why this is a kind of rehabilitation that we like very much. When we have those kind of mistake, we prefer this kind of rehabilitation respect fixed one. Okay, so all those part of the lecture was an introduction for the real topic of the today afternoon, that is the OT bridge. OT bridge is the new solution from RAIN 83 for the fixed rehabilitation. And those introduction is just to explain how we can realize the fixed rehabilitation using those kind of attachment that was born for removable prosthesis. And what's the idea? The idea is to use those kind of abutment like a multi-unit abutment. Everybody of you maybe know what multi-unit abutment is and what the function of this kind of abutment are. So, two different functions. First of all, the displacement of the prosthetic connection outside the gum. And the reason is to give less problem for the dentist during the work, and to give less pain to the patient during the trying and that. So it's much easier to work outside the gum respect to work inside the gum. But the second and most important reason for the use of multi-unit abutment is the correction of the disparallelism, the correction of the divergence between the implants. You know that if you use internal connection implant and you want to go with direct screwing rehabilitation, if you have more than 20-25 degrees of divergence between the implant, it's impossible to have perfect seal all around the implant platform. So if you don't use external connection, if you use internal connection, you really need multi-unit abutment to have perfect fit between the implant platform and your rehabilitation. So the really important reason for use those kind of abutment is that. But you know that we have two different kind of multi-unit abutment. The angulated one on the left and the straight one on the right. Straight one are a one-piece abutment, very easy to use and with no problem. Angulated multi-unit abutment are two pieces. You have the body of the multi-unit abutment and you have a screw that connect the multi-unit abutment to your implant. More difficult to use, to place, and with some problem. So the idea from RAIN 83 is to use always a one-piece straight abutment. And this abutment is the equator. But how is it possible to use always a one-piece abutment? It's possible changing the shape of the portion of the rehabilitation that have to fit with those abutments. Okay, the secret is that you have to couple one abutment inside your Toronto bridge with the equator. And how can you do that if you have divergency? You can do that because we have a wider area inside those abutments that it's called extra grade. This wider area allows you to insert your Toronto bridge always, also if you have divergency. The secret for sure is to put this extra grade portion of the abutment in the correct position. And we will show you how. The fit and the connection between those extra grade abutment and the equator is permitted by the use of an elastic sealer. And maybe Gianni can tell us how it works now.
Yes, because this elastic sealer, it's open, have the same concept of the bar sealer, but in the opposite way, because here is the first one that goes in and retain the abutment in place. And that is very important also for when you're going to try the work, and they give a better stability to the abutment, retain the titanium in place, even without the screw. We have also two rings of two different strengths. So if you have more implants, you can use the softer one for the trying in the lab and in the mouth, and go with the stronger when you're going to fix the finish. We will see that it's not only a ring, so means that it is removable. It's open because I have to go over the equator of the undercut to retain and stabilize, and then the screw are going to lock everything in position as a traditional way. But we will see that this Seager white allow in certain case to do not use a titanium screw when we have more than 3 or 4 implants. So we will see later that this ring allow you to save 25% of the screw. I mean, I have 4 implants, I can use 3 screw. I have 6 implants, I can use 3 screw and 2 without screw. So if the implants are placed and the screw giving a good stability, of course, because this ring is give to the bridge a strong retention. Okay.
Okay. So the secret for the couple of the extra grade abutment and the OT equator is the use of this Seager. But Seager is not something that came from RAIN 83 and is not, of course, something that came from dental world. It's something that came from mechanic, and it worked also in a very important situation of force. So we are sure that it worked for our job. But why you have to choose the equator if you are able to use multi-unit abutment for the construction of your Toronto or your screw rehabilitation? Because we think that we have some benefit in the use of the equator respect the simple use of multi-unit abutment. And those kind of benefits are mechanical benefit, biological benefit, aesthetical advantages, and also benefit in the organization of your daily practice. We will see all those kind of advantages to understand why we think that it's better use always multi-unit abutment straight, respect, and blade. So the mechanical benefits are related with the dimension of the screw. The screw of the equator, the screw diameter of the equator is 30% bigger respect the multi-unit abutment. And you can understand that bigger diameter means less fracture. The second advantage is related with the use of a single piece abutment. Because in the angulated multi-unit abutment, you need to find the space of the screw that fixed the multi-unit abutment with the implant. And if you need those space, you have the construction of this thin ring and a partial fillet inside the multi-unit abutment that can give you some problem of unscrewing or some problem of fracture. So, of course, use always a one-piece abutment is a benefit. And we explain you how it works. The mechanical secret is those widened part inside the exoblade. The biological advantages are related with a concept that it's called one abutment at one time. You know that the abutment manipulation give you a soft tissue downgrade, and with that, the losing of bone. And you know that if you can unscrew the abutment, you can avoid those kind of problems. But usually it's very difficult to screw something on the head of an implant and never unscrew that during the treatment plan. If you use those kind of abutment, you can do that. Because as I told you before, you can use those abutment as an healing screw and during the provisional parts of the treatment, and also for the final rehabilitation. So the principal advantages is related with the possibility to don't unscrew this abutment. And why this is a benefit? Because when you screw an abutment during the first surgery or the second surgery, so when you have the healing of the tissue, you have the formation of a junctional epithelium that is a barrier from the bacteria. And if you can maintain this barrier, for sure is a protection for the health of your implant. The second reason is that the screw thread is not in communication with the internal part of the implant. And of course, if you have a communication of the screw, of an external screw with the internal part of the implant, this is a door for the bacteria. If you don't have that, you have a closed door and you are more safe situation for your implant. But we also have the possibility to don't want to use those kind of abutment for maybe for something like immediate loading. So maybe you want to put your implant and wait for the healing before to load those implants. In those cases, you can use an healing cap on the head of your abutment. So during the first or second surgery, screw your equator and use those healing screw to protect the seal of your flap and to maintain the junctional epithelium in the apical part of the attachment. Okay? The aesthetical advantages are related with two concepts. The first is the dimension. Those kind of abutments are available in all the height. And they start from 0.5 millimeter for the internal connection implant. You know that the multi-unit abutment, angulated multi-unit abutment, starting from 4 millimeter high. But if you have some divergent implant in an aesthetical zone, and you have to put your angulated multi-unit abutment, and you don't have 4 millimeter high of gum, maybe you can have the problem of the metal part of the multi-unit abutment that comes out from the gum. So safe space is very, very important. And you know that those kind of abutment is available for all implant brand. And as I told you before, in a lot of these, you can have it in 0.5 millimeter for the internal connection and 2 millimeter for the external connection. So save a lot of space and for sure have better result in the frontal zone. But the second aesthetical advantages is related to those things that Gianni told you before. So sometimes you can use those abutment in a way that we call blind way. So without the use of the screw. And if you have a case like the one in the picture with the hole in an aesthetical zone, if you can use it in a blind way, you don't have the problem of the hole. So this is a very interesting solution, okay? You have to understand that you can't use all your implant, all your abutment in a blind way because it's not removable rehabilitation, it's fixed rehabilitation. But sometimes if you have those kind of possibility, it's very interesting. Now, it's available also an abutment angulated, 15-degree angulation of the abutment that can save you the possibility to have the hole in the external wound, okay? On that video, you will see how it works, and Gianni maybe can told us better.
Because, you know, we have a possibility. The common one is to use the titanium abutment, prefabricated, but also we have the angulated titanium abutment to bond the metal structure to cement a fix. Of course, this goes together with one angulated screw and angulated screwdriver that can adjust, you know, different angulation, correct different angulation, and this screwdriver is screwing the 15-degree, but is going to rotate till 25. So if you have to screw the titanium screw in the prefabricated angulated, this go till 25, because you need, maybe sometimes you need, you know, to design just the hole in the best position to save the aesthetic. So that is very important to have also this option, how you can see in the video, to give the good aesthetic result and to correct angulation using the same equator abutment straight on 0 degrees. So we don't have to go crazy like the multi-unit to have 17 degree, 25, 27, 1, 2, 3, 4 millimeter cuff. Here you have only equator, different height, and then you choose the straight or the angulated abutment to cement, to be bonded into the metal structure to retain a fixed bridge.
Okay, and the last group of benefit that we identified in the use of this kind of abutment is the organizational benefit. And I think that those kind of advantages is very, very important in the daily practice. You can use a single connection for fixed and removable prosthesis. So in the organization of the daily practice is very important. You don't have to check what kind of attachment to use, because if you have a treatment plane, mixed treatment plane with maybe removable provisional and fixed final rehabilitation, you can use the same abutment for all your treatment plane, okay? The second reason is that you have the same component for each implant platform. It means that in a case in which you have two different kind of implants, maybe old implant from old patient that you haven't put, maybe you want to use different kind of implant. If you want to go with fixed rehabilitation, you have to check different multi-unit abutment, different screw, different abutment, everything different for different implant platform. But if you use those kind of abutment, you always have the same component for different implant platform. Okay, and we will see together a case, a clinical case, in which these advantages has been used. The last reason is that those kind of abutment is available always also for unknown implant. So if you have to manage implant about what you have lost the specific, you can go in the same way of always. You just have to customize those kind of abutment for those unknown implant, and after that you work as always. Okay, and also for that we will see together a clinical case.
Yeah, it's very important. You know what change in to choose the correct titanium abutment extra grade. We have a different platform in the market. Okay, so if we have a wide, for sure we'll make one equator wider. If we have a narrow platform, the equator will be narrow. So you need the only things that you need to choose the correct extra grade abutment that you can see on your left, that can be 3.5, 4, or 5. So that are going to cover all the platform in the market. How you choose the correct abutment correctly? You have only to go into our website, in the Rhine 83 website, you go in the OT Bridge area, and then you can see that there is where you have to type the name of the implant. You can see here, I type ADVA, that is the GC implant. Okay, you can see even if it's a little bit small, and you see depends. If it's the narrow one, you have to use the anti-sag, that is a 3.5. If it's the regular wide, we will use the 4 millimeter to have a perfect connection. Okay, so we need one abutment that fit perfectly in the diameter of the equator, that doesn't have to go in over contour, but have to stay or in the narrow than the platform or on the same line to have a perfect sealing, or narrower if you need to go like a platform switch solution. Okay, so never wider. So to choose the correct abutment, just take a look of the website in the area where you have to type the name of the implant, diameter of the implant, and you choose the correct abutment. Is also important, and you can see here in the video, the extra grade, how Emiliano told you, correct till 80-degree divergence between implants. The equator are always straight. Why is they correct? Because they have one wider area called extra grade that is corresponding the flat area and the open part of the Seeger ring. So always you have to position the flat part and you see the open area where you have the maximum undercut of the abutment. So you can see that here in the distal is on the distal side, the flat area is in the direction of the maximum undercut. That is the only things that change from the standard technique of the titanium abutment from the market. Then you see how I told you before, you choose the technique that you want. Walks up, scanning, digital, it's up to you. In this case, they wax up, they cast, and then they have only to use our composite, OTCM, bond the metal structure in position. The abutment will be locked in the frame, in the structure, in the right rotation to allow the structure to go out and in easy. So that is the only thing. Rotate correctly the extra grade abutment following the direction of the implant. So that is the only thing that is very important, that is mandatory using our solution. After that, it's very easy and it's simple. You can see by using the solution how is easy to go using these components.
Okay, now we will share some clinical cases, some different clinical cases, different solution, same solution for different clinical cases, but very common cases that you can face in your daily practice. The first is a case of a patient with overdenture, so soft tissue supported overdenture, that want something that's working better. She wants fixed rehabilitation. She had 2 old implants, not positioned from me, so unknown implant for me. And now she wanna go for an upgrade with fixed prosthesis, rehabilitation. So what I have to do is to put the 2 more implants and waiting for the healing. Because in this case, I don't need to go with immediate loading because patient is satisfied with the retention of the denture. It's an whole denture that worked for a long time. So you know that immediate loading working for sure, but you have little more risk respect delayed loading. So if you don't have to go in immediate loading, I prefer not to go. In a case like this, I can use the whole denture for the retention and the whole structure for the retention during the healing and waiting for the healing. And after 2 months, when I go with the second surgery, as I told you before, I use those kind of abutment like healing screw directly. The day of the second surgery, I screw those abutment and I use it like healing screw and for the retention of my whole denture. Because the same day I take out the whole structure on the implant unknown, I send it to the factory and I have back my equator. Okay? So in the second appointment, this is my situation. I have my new 2 implants in the frontal zone and the whole implant in the distal zone, but the same implant platform, same prosthetical platform. And that's the first benefit that I told you before when I told about the advantages in the organization. From now, you can go with the same component for 2 different kind of implant. And this is a big advantage. Okay? You can use a different device to take your impression because Reality 3 gives you the possibility to use different kind of transfer. This is how I like to take the impression when I need a very precision impression. I want to customize the screwed transfer with a little bit of acrylic and use it with a customized impression tray. The reason is to have less impression material possible. Because you know that all the mistakes that you can have during the impression time are related with the quantity of material, because more material means more contraction, and so you can have some distortion with respect to the real position of your implant. So how you can use it on that way? With customized transfer and customized impression tray, you can have the perfect position of your implant. And in a case like this, I usually want the construction of a duplicate of the whole denture that help me in the impression of the relationship between upper and lower jaw. So same kind of transfer fixed on 2 implants and with a little bit of resin blocked with those duplicate. On that way, I go with the duplicate on the master model and I can save the information related with the whole denture. That's what I like to do when I'm happy about the situation and of the whole rehabilitation and I don't want to lose some information. The way to maintain those information is the duplication of the whole denture and the use of those whole denture to take the impression, to take the relationship between upper and lower jaw. After that, we have the hold articulator. We go with the walks up. One other advantages of this systematic is that when you go in mouth with the walks up, you can maybe use two attachments inside the walks up to have more stabilization of your walks up, to do aesthetical trying, to do phonetic trying. For all your appointment of trying, you have more stabilization using the same kind of attachment. You don't have to unscrew nothing, okay? So this is one advantages I like to think. So, like you saw in the case of the bar, we go with the acrylic contour key in mouth. This is just an evolution of our customized transfer, just blocked with resin, to be sure that our master model is perfect, respect the situation in mouth. So now we have the walks up that work very well, and we are sure about the position of the implant. We have all the information to go with the final rehabilitation. In this case, also in this case, in a CAD/CAM way. But like Gianni told you before, you can do that also in traditional way. In this case, new CAD/CAM way, and Gianni, we told us all the step about that.
Is you know, traditional, like as always, we have the scanning of the upper jaw, and then we have only to, using the scanner of the lower duplication, we only check of the space that we got, thickness, and we are going to position the attachment in the best way as possible to do not compromise the final aesthetical result. This, we choose that way to go in a laser melting technique because we have to design the bar not really straight and without chance that a milling can do it. This is like a casting, but is a laser welding, you know. So it's we do the check, the shaping check, because we screw one screw on the posterior to see that doesn't move. After the shaping check, give us that everything is okay, the information. The problem of the laser melting is that the surface is always a little bit rough, because, and this is very bad in the connection area. We are working with milling center that are going to re-mill the laser melting where are the connections. So you can see here, they are reproducing perfectly by milling later that the laser melting are done, the extra grade and the room for the Seeger ring. So that is very important, because the precision of the connection is something that is mandatory, like the polishing of the structure. You have to polish the structure, how I told you before, to let the patient clean perfectly and finish the connection perfectly, not to retain any bacteria or food or dirty things that are going to compromise the final result. So here we have the final denture. It's not a denture, but the final bridge, because it's screwed. So you can see that you have the screw, you have the Seeger ring. When we told you before that the rotation of the abutment, the Seeger, the extra grade abutment, is very important. Same story here. They go directly. They are not going. They don't bond any extra grade titanium abutment, but they go straight to the equator by designing the structure with the software. So you can go with two different techniques: bonding the titanium extra grade abutment, or designing by laser melting or milling directly the Seeger abutment in the structure. Is important the extra grade position if the implant are divergent. In this case, you see the implant are mostly parallel, so the rotation of the figure with the open part is not important because all the implants are almost straight. So we don't have to take care too much of the position of this figure ring.
So this is the final results. Very important, the maniacal polishing of the portion of the rehabilitation that go in contact with the soft gum. And as you can see here, what I told you before, different kind of implant, same connection. So this is a very important benefit. In this clinical case, what I wanna let you is important to have the same connection for different kind of implant, and the important to have an attachment that help you during the provisional time for the retention of the denture, and help you for the final rehabilitation for the screwing of the Toronto bridge. Okay, those is the meaning of this clinical case. That's why I wanna share with you those clinical cases. This is the final result with the check of the space for the home hygiene, and that's all. But this is a case that I told you, as I told you before, I prefer to go in delayed loading, but sometimes you have to go in immediate loading. We have different cases, but we don't want to share because it's a little bit long. We just want to show you the way to build, to easy build provisional in a way that it's called wire reinforced provision. Okay, there's a video that Gianni told you.
Because you can now just see who is going to do the immediate loading using our solution. It's important to have this kit in the office because it's ready with all the equator for his platform that he's using. For example, Emiliano, stop the video 1 second.
Yeah.
You can see that if Emiliano is using GC Adva implants, may have the 2 diameter of the GC implants with different cuff. So he's always ready to use the proper equator in the dental office by picking up the abutment from this kit. It's a 42 abutment kit, and then don't have to order from Michael and then waiting the delivery. It's ready to go because immediate loading need to be fast and ready. Okay, so you choose which is your stock of equator according to your platform brand, and then you choose. You can go, Emiliano. Now, to go fast, we design one specific abutment that allows the technician to create a reinforce in a super fast way, because even you can see here in a kind of divergency like 60, 80 between implants, there is no problem. Okay, then they take the impression. That is a standard way to go. Impression tray. So always the doctor can use the equator for retains the temporary, but in this case it's an immediate loading, but maybe they have the old denture, they can stabilize. We do the master model using our analog in position. We cast the model in stone, and now we are able to position a specific temporary abutment that have 2 holes to allow a titanium wire to connect each other in a fast way. So in the lab, in a 20 minutes, is ready to have a connection framework, and he can now just setting up the teeth according to the wax up that they did previously. So position, raising, and now we are ready to deliver this temporary bridge to the dentist, waiting for the final one. Okay, so that is a very fast way. You can see that is pink. In case we have high divergency, we, in this case, customize the extra grade with the bar, with the burr. So we open if we need, because this abutment doesn't have, because we cannot rotate before, but we have to follow the hole for the titanium wire. So that is the only thing that we have to customize. And now we are ready to go. We insert the cigar ring. We can help to have a little of Vaseline to let this ring click. We rotate, we have the correct position, open on the distal. You can see the ring is open where we have the maximum undercut. This allows the bridge to go in position. Now we are ready to insert, to deliver it to the dentist, the bridge, and is able to insert this in the mouth. He can screw. In this case, the screw doesn't give us any problem. Emiliano, stop here 1 second. Go back 1 second. Just 5 seconds. Okay. Okay, if in this case, one screw have a problematic direction, we can just use 3 blue titanium screw and 1 blind abutment using only the retention of the cigar to get very good stability and aesthetical result at the end. Okay. So go ahead.
Okay. Okay, so we have shown you how to go in delayed loading. We have shown you how to build very fast and in economical way a provisional. But sometimes we can also go in immediate loading with a final restoration, specifically if you go with guided surgery. The advantages of guided surgery are that you can choose the high of the equator during the project. Okay, as you can see in the lower picture, you can check the position and the portion of the gum, and you can choose the correct high of your equator before the surgery. So if you choose to go in the guided surgery, you have the advantages of those kind of surgery. That is for sure, that is a flapless surgery. The day of the surgery, you arrive with your surgical template, with the provisional, with the correct high OT equator, and I prefer go with this guide for the position of the extra grade. This is very important if you go with the tilted implant, not very important if you go in straight implant. So if you have the anatomy that allow you to go with straight implant, not important, but sometimes maybe you can go with guide surgery for all-on-4 with tilted implant. So this is very important. The surgery is, as usual, surgery with, as I told you before, the advantages that it's flapless. So it's fast because you don't need time for suturing, and it's better for the patients maybe because no pain, no swallow, no blooding. So a lot of advantages for the patient. It's a surgery that you can choose in some situation, but the same things that you see now you can do also in freehand surgery. The advantages in this case, as I told you before, is that we have our rehabilitation that it's ready before the surgery, and we just have to bond the abutment directly on the implant. In this case, we have some trouble with an implant. So the project was to put 6 implants, but we have a problem with a broken screw. So in the first surgery, I put only 5 implants. After 2 months, after the healing, I go with another implant, and on that way, I will show you the particularity of this situation. In the video now, I come back a little bit. Okay. Here, you can see how it's easy, the positioning of the abutment at the end of the surgery. On that way, you can go also in a difficult position in the mouth, and you can check also the force of insertion with the use of contraangle. Okay. I want to go with the second video, because in the second video I will show you how to fix the rehabilitation directly on the abutment. This is after the positioning of the implant that was failed. So little flap, positioning of the implant, and the screwing of the abutment. Okay, very easy with the control of the Newton of insertion. And now waiting for the coupling of our final restoration with the OT equator, we have to go with suture. And here you can see how to use the healing cap, because I want to go with my suture, but I want to maintain a good profile for the emergency of my rehabilitation. So before to go with this, the suturing, I use this healing cap. Very easy to use. You can go with hand with hand positioning, or like in this case with the contra hand.
You see, Emiliano, just to see, you can see in the video that you now often you choose to stay below the gum with the equator to save, to give always one aesthetical design, because we go outside with the pink in the lab already. So that normally we, as a dentist, choose to stay below the ridge to go out from the ridge with the aesthetic part and without discovering any metal, correct?
Yeah.
I also want to add, because it's one new product, now, you know, Emiliano had used the healing with just a square. Now we have the same screw, but with the equator on top. So in case you have the equator below the ridge, you can move the head of the equator thanks to the healing equator outside the ridge, so you can use it to retain a temporary waiting for the final work. So just is a double functionality that you may have using the equator solution. Sorry, Emiliano, just to add a few information.
In this case, I've used the normal healing cap just because I need it only for a few minutes, the time of the suturing, because I want to preserve those kind of space all around my equator. Like Gianni told you before, I like very much to go in the deep of the gum with those kind of attachment in the fixed rehabilitation, because I prefer to manage the emergency of the teeth to change maybe the aspect in the aesthetical zone. Okay, that's why I prefer to use those high of equator. But what I want to show you in this video is how is too easy the bonding of the abutment to the rehabilitation. This is the screwing of the final abutment, and I take the protection with a little bit of dam, or in this case is dam because I want to protect also the suture, but always you can use the gum that you have directly with the equator, so, and with a little bit of acrylic, just waiting for the curing, and we have the connection also with another implant that we have. We couldn't position during the first surgery because we had a mistake. Okay, so I think very, very easy, and this is another advantages of those kind of systematics. As you can see here, there's a cigar of the pink color, and this is the temporary cigar. Like Gianni told you before, we have two different kind of cigar: the white one for the final restoration, the pink one for the temporary. Okay. The last case that we want to share with you is the case of unknown implant. Fortunately, it doesn't happen very frequently to manage those kind of situations, but sometimes it can happen because of the worldwide use of implant. You know that some very often implants survive the prosthesis. And if you have to manage this situation, sometimes you can have the patient that doesn't know what kind of implant have in the mouth, and maybe he have lost implant passport or lost contact with the dentist, so you can't understand what kind of implant they have. This is a case of a patient that came to my office with the teeth in the pocket, and she just wanted to new screw those teeth. But as you can understand, in this case, we have another mistake. We have broken screw inside the implant. So now we have two problems to face. The first problem is to take out the broken screw from the implant. And the second mistake is we don't know what kind of implant they have. But for that, we have a solution. For a long time now, Rain 83 give you support in this situation because they can customize some attachment for any kind of implant, also unknown implant. And today, they can customize for you also the equator. And as you can understand, if you can build fixed rehabilitation on the equator, and you can have customized equator for implant unknown, you can go with fixed rehabilitation on implant unknown. So very easy. What you have to do, you have to send to the factory something that was screwed on the head of the implant. So in this case, an abutment. But if you don't have an abutment, it's enough a cover screw or an in screw, something that was screwed on the end of your implant.
We need to have the positive or the negative of the implant in our factory to read. Is also important, even the healing screw, because the equator do not have any octagon hex. It's only one piece abutment, so it's very easy for us, even if we do not recognize which implant is, to read the design. We scan the profile and we just create a perfect sealing of the equator abutment according to the information we receive. So in the next picture that Emiliano will show you, the latest possibility is if you don't have nothing in your hand because you have two open implants and nothing screwed, the last possibility is for the doctor is to take the impression of the internal implant design. So how you can see here, by this impression, we read the thread. So it can be 1.6, 1.7, 1.8. So we read the diameter and brand and kind of the thread, and we read the platform. The platform, we read the diameter according to the precision of your impression. But for us, it's enough that we have half of the platform of the implant, because it's circle, to read and to create something that's sealed. To be safe, if we have only the impression, we stay a little bit narrower to give one platform switching possibility, so easy to clean, and then we can manufacture, and Emiliano receive the true equator for the unknown implant. And that is something that may happen also in your country, that one all-on-4 fail, and you have to renew the prosthetic but you have to use 3 existing implants that maybe you don't know which brand it is. So you can manufacture equator and the one that Emiliano is using, AGC, Sweden and Martina, or other brand, anyone you want to have at the end 4 equator platform. So the dentists always use the same abutment without any problem about the brand of implant or diameter of the implant. Okay, sorry, Emiliano.
Good. In those cases, the first mistake that we have to manage is the extraction of the broken screw. And for that is available a kit that it's called broken screw extractor kit that work if perfectly fit with the head of the implant. So same things for build a customized abutment. If you don't know what kind of implant it is, you just have to take an impression or send something, and you can have a customized kit for the extraction of the screw. Why? Because those kit is composed by two parts, and the first is a central device that have to couple perfectly with the head of the implant to give stability to the burns that working to take out the broken screw. Okay? So if you know what kind of implant you have with the broken screw, you just have to say, I have broken a screw inside those kind of implant. If you don't know what kind of implant it is, you just have to do like Gianni told you before.
But just 1 second. For the broken screw, it's different than the equator, because the equator is not going to engage any internal X or external X. The broken screw have a driver, how you can see here, that have to fit perfectly. So we need to have the information of the brand of implant, or how in this case we add the hex or kind of, specific design of the connection. So we have go and we know which implant was, recognizing the piece of component that we receive from the dentist. So for equator, we don't need to understand which implant is, but for the broken screw, we need to know the brand of implant and the diameter, because the hex, internal or external, may change, depends. Okay, so this is a little bit different because the driver have to be perfect and straight.
Yeah, because the driver must perfectly fit with the head of the implant. So this is the portion of the screw that is taking out, that we have taken out, and this is the situation on the same appointment. After the extraction of the broken screw, we can use our customized equator, and from here starting to have our rehabilitation. What I want to show you in this picture is that before the extraction of the broken screw, I've ordered two 2mm high equator, because the abutment in the whole rehabilitation was 2mm high. But this is not the result that I want. So first of all, I've screwed those two abutments, but after that, I've reordered two new equator, only 0.5mm high, because I want that the equator stay deep in the gum. And I show you later the better aesthetic result on that way. For the provisional, we just take an analog impression. The reason why we go with the provisional, in this case, with the osteo-integrated implant, is just because we prepared also natural teeth. So we have to wait for the healing of the gum after the preparation of the natural teeth. And during the healing of those provisional, we go also with the provisional on the implant. But with the osteo-integrated implant, healing implant, you don't need, there's no reason to go with the provisional. But very easy way to realize the provisional. Gianni?
Yes, you go back one picture, just a second. So is another back, from the model that the impression, okay, here you can see what is very important is that for a non-implant, for non-implants, you have always the equator head. So from now, you use all the device that we have already in our stock. So transfer the position of the equator. So you have all the tool to proceed to create a bridge, a little bridge. It's very important because the OT bridge solution, it's working for not less than 2 implants, because the only, you know, indication where cannot be used the OT bridge is for a single bridge, because the abutment is rotating. So from 2 implant and over, so 2, 3, 4, 5, 6, 7 till any, you can use our system with the technology that you want. So from this model that you can see, we can use the castable ring to create and to bond the titanium SIG extra grade abutment, or we can use the scan abutment to design digitally, how we can see in this case. So they scan, we design with the CAD the bridge in zirconia, we are ready with the provisional, then we go and we send the provisional to Emiliano. He try with the temporary SIG rings, the softer one, to check the fitting, the aesthetic, the relationship between the upper arch. So this is how it was in the lab and how it looks like in the mouth. Okay.
For the final restoration, after the delivery of the provisional, we go all in a digital way. So in this case, we go with the intraoral scan of the equator using those scan abutment dedicated. Okay. The same way, we go all in digital way for the realization of
3D printing, digital analog, because every scan abutment contains all the information. So if Emiliano takes the digital impression with the scan abutment, we can go fully digital for 3D model, 3D analog, and we design by, as a software, the bridge. Same as, you see, we have a specific analog that are in the library that we will give you together with the scan abutment when you need. So who is fully digital dedicated can go with a fully digital technique. Who is analogic, they can go with a standard technique using the equator, the extra grade by the bonding or the casting. So we want to offer a wide range of solutions to support all the dentists and technicians, depends the technologies that everyone or the needs that everyone we have in our clinic or in our lab. Now you see we design room for the porcelain, and we can now create the final restoration. Zirconia ready to go. We do the check.
Yeah, this is the test in the mouth of the raw ceramics, and when we are happy about that, we just go for the finalization. In this case, as you can see, there's no important in the direction of the extra grade because we had straight implant. So as Gianni told you before, very important is to check the position of the wider area of the extra grade when you have tilted implant. In a case like this, that you have straight implant, no problem. Okay, and so as you can see, the position is randomized position of the extra grade portion. So what I told you before, this is the day of the delivery. I prefer to use low profile attachment and 0.5 high when it's possible to stay inside the gum to have these final results. Because as you can understand, this is not a situation with very important aesthetical desire, but you can have the same situation in an important aesthetical portion like premolar or something like that. So in this case, if you stay inside the gum, you can have better profile of emergency of your tooth, and you can have better design of the papilla to have a better pink result, better pink aesthetic result. So this is the final check, Eric's check. As you can see, no implant, but perfect fitting of the restoration with the head of the implant using those kind of abutment. And for me, maybe this is the perfect way to conclude the lecture, because here you have all the potential of this kind of abutment, because you can do with final restoration, fix it on unknown implant in an easy way, digital or analogic. So all the potential of this equator is in these clinical cases. Also, if it's a very little kind of rehabilitation, okay, just two tooth, okay. But this is the only way that I know on the market to go with a fixed screwed rehabilitation on unknown implant. The only way you have, okay. So with that, we have finished our lecture, and I leave Gianni to say something if he wants, and I'm here for some question if you want.